Dr. Ann Schuchat, Principal Deputy Director of the Centers for Disease Control, joins us now from CDC headquarters in Atlanta. Dr. Schuchat, good morning. Thanks for being here.
A pleasure.
As we just heard Nancy Cordes allude to, there's some mixed messages that seem to be coming at us on the coronavirus. On the one hand, you've got the White House saying it's tightly contained, and you've got the CDC saying the spread of the virus here is inevitable. What are we supposed to make of this?
You know, it could be a confusing time right now as we've seen the coronavirus spread in China and now in a number of other countries. The good news is that here in the United States, the virus is contained. With an aggressive approach, we've been able to keep the numbers down. Only 14 cases detected through our public health system and medical system, and 43 other cases detected among people repatriated from hotspots in China or on the cruise ship. But as we see outbreaks in Italy, in Iran, in South Korea, we need to be prepared in case things change here.
Dr. Schuchat, your if and when scenario was a little unsettling for a lot of people because you said it's not a matter of if, it's a matter of when. Do you have a timetable in mind, and are you concentrating on a certain part of the country?
We really need to be ready everywhere. We've seen in other outbreaks that there can be what's called a popcorn pattern, where one community has an outbreak and another doesn't. You can see that that's what's occurring in Italy right now. Northern Italy has more disease that we're not really seeing it in other parts. So we cannot predict exactly where there may be community transmission. We can't say for sure if we will get community transmission, but based on what we're seeing in Europe and the Middle East, we think it's more likely than we thought a week or two ago.
Doctor, when you talk about the approach, what specific steps is the CDC taking to prevent a wider outbreak here in the U.S.?
We have been working aggressively on a border strategy at airports and on a strategy with clinicians to detect individuals who have this virus early and to manage them appropriately. We've learned a lot in the last few weeks about the virus. It doesn't seem to be as severe as we first feared, but it does seem to be quite transmissible. And some people have very mild symptoms or possibly even no symptoms at all.
We're hearing you say that the screening is in place for people who are coming here. What about people who might have already been infected and who are already here? What about those people?
Absolutely. One of the things we're doing is increasing what we call community surveillance so that we can find cases earlier, so that we understand whether there already is virus circulating that's been undetected.
Who is most at risk for getting infected by coronavirus?
Based on what we know so far, the severe cases are primarily occurring in the elderly, in adults with chronic conditions like diabetes or chronic lung disease. We haven't seen disease to any great extent in children, and that's a difference with seasonal flu or other influenza. One of the big drivers of our flu outbreaks each year is the high rates of illness in children, but we haven't seen that with this virus. Something we're on the lookout for, but that hasn't been detected so far.
All right, Dr. Ann Schuchat with the CDC, thanks so much for being with us this morning.
It was my pleasure.